Namaste and welcome to the next lecture of Clinical Ayurved. Myself, Dr. Mayuresh Agte. We are discussing Pandu Vyadhi and I have put a question in front of you that you have two kalpa on Pandu Chikitsa. One is Dhati Loha, another is Navayas Loha, and there are two patients of Pandu in front of you. How will you choose that Dhati Loha is to be used to which person and Navayas Loha to be used to be in which person? Why I am deliberating this question in front of you? Because during the course of time when we practice, we really know the names of the kalpa, but many times the contents of the kalpa are not considered when you are using in some patients. So I have Dhati Loha with me and Navayas Loha with me and two patients of Pandu. Let us discuss in detail. Now in last lecture I had told you the three main factors we considered in the clinical practice when there is Pandu. When one is malnutrition, second is Dhatogni Mandya, specifically Jathagni or Raktadhatogni Mandya, and third is bleeding conditions where Pandu appears as a symptom. Now Panduta appears in many of the diseases as a symptom, but dominantly these three conditions are very important when you are treating Pandu as a separate as a disease. So when there is such conditions, how you will decide the Dhati Loha and Navayas Loha to be used in which patients? For this, you have to go with the contents of the every kalpa you are using in the practice. If you study the Dhati Loha, you will find Loha Bhasma is common in both, but in Dhati Loha, you will find Amalki as a main content, and in Navayas Loha, you will find Triphala, Trikatu also along with Loha Bhasma. What it indicates? It indicates Dhati Loha is indicated in malnourished patients because in that patient only nourishment is required, and hopefully it is considered as Agni is in a good condition. Only malnourishment is the cause of the Pandu, then Dhati Loha is main indication. On the contrary, in Navayas Loha, there is Trikatu like Dravya and hence they are Agni Vardhak. So, when there is Agni Mandya or mainly Jathani Mandya or Rakta Dhatvani Mandya, in that case, Navayas Loha will be the best choice because it will act on the Agni or Dhatvagni. Third condition, if there is Pandu as a main symptom because of some bleeding conditions, then you have to think of the Dhati Loha again because it is Rattastambha because of Amalki, Shitavirya, Sammanihima. If you use Navayas Loha in that conditions, Hetu is Rattastrav from any part of the body and it contains Trikatu as a content, though there is Loha Bhasma. This Trikatu is, Krishna Ushna Viryatmak, so it will add to the Hetu. Hence, when you are using any kalpa, always remember you should know the exact content of that kalpa and the exact samprati which is happen in the patient. Then only you can realize that which kalpa will be suitable or indicated in those patients. Now I have not put some a different aspect of Raktadhatu. We know that Raktam Jivam iti sthiti. What it means? That every cell requires Raktadhatu for its jivita, whatever dhatu or tissue it is. So, if you have to uh, strengthen any dhatu or disease of any dhatu, can we add a lohokalpa, one lohokalpa by default for this Raktan Jivan iti sthiti? For example, there is Mamsakshay, Medakshay, Asthikshay, whatever it is, and you have to recover that Dhatukshay. Shall we add a lohokalpa along with the treatment, specific treatment of that dhatu, because that Raktan Jivam iti sthiti will enhance the process of proven of that specific dhatu. I am just putting a thought in front of you. If you go with the diseases, you will find maybe because of this reason, you will find both most of the systems in their chikitsa and also the chikitsa, you will find loha as a content. For example, in Medava Srotas, you will find Punarnava Mandu. In, for example, Garbhashay, there is Ratta Pradar and like that condition, you will find Kanya Lohadi Kalp or Chandranadi Loho and much more. This may be the reason that because of Rattanjam iti sthiti, you can add a Loha Kalpa or Loha Bhasma or Suvarnamakshi Bhasma like content in your treatment that will enhance the that Srotas as a for recovery because Rattam Jiva iti sthiti. Now there are two factors, Rattam Jiva iti sthiti and Rogas Sarir Mandirna, as we all know this. So Agni or Jatragni, Prakru Jatragni and Prakru Chattadhatu are important conditions for in any treatment. Hence, maybe because of this reason, we all of us use Arogya Vardhini as one of the content in many diseases because it works on Agni Mandya, Jatragni as well as content are good for Ratta Dhatu Nirmiti also, and this may be the reason that two main factors of the body are taken care of, and hence Arogavardhini is one of the usual content of our treatment. I have not gone into details of the Sampratya of the text because all of you know the Pitta, etc., Dashadhamani Prapya, vagara vagara. But main thing which clinically we had to consider, we had discussed as a hetu in the last lecture, and in this lecture I have tried to elaborate that when you are using any kalpa on any disease, always you should be sure about the content, all the contents of that kalpa and their exact indication in the patient in front of you. We will meet with another chapter, another lecture or subject in the next lecture. Thank you very much. Please subscribe the channel and ask your friends also to subscribe the same. Thank you very much.